Hello and welcome to our special updates webinar that we pre-recorded for you. We have a few updates that came over at the end of last week, and we really didn't want to wait until the Thursday webinar to give you those updates. So we went ahead and pre-recorded this webinar for you so that you could have the most updated news. Then, of course, if you have any questions, please let us know once you've watched this webinar, and we will be more than happy to help you and answer those questions for you. So I will turn it over to Crescent, who will give you the update.
So like Lexi has referred to, on Friday late evening, there were several changes that came in through CMS that we wanted to present to you. So Lexi, if you can go to the next slide, please. So there has been some expansion services that are going to be allowed for telephone visits, which is your audio only, and they are waiving the video requirements for lots of visits that were originally set to have video in order to bill for these services. Some examples of those services are some of your brief emotional and behavioral assessments, your diabetic management training, tobacco use counseling, and alcohol screenings. Your annual wellness visits can now be done via audio only. There was a full list that was published, and you can sort that list by audio only at the below link. The other big news that they had is that they are changing the fee schedule for those telephone visits. They are increasing them from $14 to $41 to $46 to $100. This puts this in alignment with your normal E&M visits so that you can get a better reimbursement for those telephone calls, being that you are doing complete assessments through those telephone calls. Payments will be retroactive back to March 1st. However, it has not been made clear yet on if they will do an automatic reprocessing of these claims. And as soon as we find out that information, we'll be sure and relay that information to you. Home health services, the changes that they have made for that is that physician's assistants, nurse practitioners, and clinical nurse specialists can now certify and order these services. They have announced that this will be a permanent change to the CMS guidelines that go into effect on all services on or after March 1st. They'll be able to certify eligibility, establish, and do periodic reviews of those care plans. COVID testing, no, you will no longer have to order the COVID test by the treating physician. Any healthcare professional that is authorized to do so under the state law can order this test now. And providers may bill a 99211 for assessment and specimen collection of the COVID-19 test. So if you are collecting these in your office, you can bill out to the 99211 and be reimbursed for that. Medicare will recognize these codes as billed for the patient, and it's not just for established patients. CMS has also said that they'll be covering certain serology or antibody testings that have been approved by the FDA. That CPT code is 86769, the antibody for severe acute respiratory syndrome of a coronavirus 2, and approved coverage for FDA approved testing that beneficiaries can self-collect at home. If you need reference material as to regards to all of the things that we have discussed, these are the links for those in those files. You can get further documentation. There is a very lengthy document in there that can be reviewed with all of the further regulations if you had further questions, but these were the main points that we wanted to bring to you today.
Also, Crescent, this is Lexi. I just wanted to add, if you are interested in doing the antibody test, we have got documents and information from CPL, and it's a pretty easy process, and they have the documents for what codes need to be billed and how to do those. So if you want more information on that, reach out to your PBE, and they will be able to provide you that documentation and that process for starting to do those.
Excellent. Thank you. So here's some of the information that came over from CMS on the testing requirements and who is authorized to do these testings. I highly suggest that you read through this to make sure that you are covered under these testings. Most of everything is covered if it is drawn in your office. Both the testing for COVID-19, the antibody testing, any antigen testing, what laboratories are approved to do, and the at-home testing. The at-home testing has to be an approved FDA at-home test. So you need to make sure that if you're doing those or sending those out to your patients or have a source that is sending those, in order for those to be covered, they have to be FDA approved. Next slide, please. So for doctors' offices and hospitals, Medicare is paying separately for these specimens to be collected. There have been, they're expanding every day on what is approved and not what is not approved and who can draw these testings. This just kind of is a overview of exactly the things that we talked about not having to have orders from your testing physician, what nursing homes are are able to do, and at home, what your pharmacies can do for you by your local pharmacies, and your drive-through testing and alternative sites of what is covered with them. Be sure that you are reading and making sure that these are the FDA approved tests. At this time, this is only documentation for Medicare services. We have not heard from our commercial payers or our Medicare Advantage payers. We do expect them to fall into line with this, but they have not made any announcements in regards to that as of to date. So this is strictly Medicare information at this time. And as always, if you have questions, please contact your PBE or Lexi or myself. We'll be happy to answer any questions that you have in regards to the information that we have provided for you today. Thank you.
Okay, thank you very much. And as Crescent stated, just please contact your PBE or any of us if you have any questions, and we will continue to provide you updates as soon as we get them. So I hope you have a great day, and let us know if you need anything. Thank you so much.